Adamawa and Niger states, two of the most expansive states in Nigeria, remain among those with the hardest to reach areas for routine immunization exercises. In many communities across these states, childhood begins with both hope and uncertainty. Distance, terrain, awareness gaps, and limited health resources have made it difficult for some children to receive the vaccines they need on time.
Sunana Hawa Yakubu, mahaifiyan Hawa Ibrahim. Wata rana dai muna samu mu je inda abun hawa za mu je kai tsaye. Wani rana kuma baka samu abin da zaka hau zaka ji ƙuya yana so ya shige ka. Amma duk da haka sai mu yi kokari. Ka dai yi kokari ka samu ka kai yaran saboda su samu cikakken allura din.
In communities like these, reaching every eligible child requires more than vaccines. It requires accurate data, community trust, trained health workers, and a clear understanding of where children are, which children have been missed, and what resources are available to serve them.
There are many children who have started immunization, they did not complete. Maybe because of one reason or the other. Some people will complain of from their homes to the health facility is far. They don't have money for transporting their children to the facility. This type of complaint.
In the Kunkele community, we normally face challenges in hard-to-reach areas, poor road, bad network, non-compliance, and it makes it very difficult for us to carry out our vaccination activities.
Every child reached begins with someone making the journey. For vaccinators, every visit is an opportunity not only to administer vaccines, but to build trust, address concerns, and bring essential health services closer to the people who need them the most, while ensuring no child is overlooked.
Now, what do we aim to achieve with this project? So we've come to Adamawa State to help them reduce the zero-dose burden by 20%. And to do that, we have deployed the IEVS strategy, I to identify, E enumerate, V vaccinate, and S to sustain what we are doing.
The DTCM, they used to go to the houses and track the children, mobilize them, refer them to the facility. And the facility, I can say, the vaccinators are even going together. They are almost around the houses, outside the houses, door to door. So no one will complain on saying that they don't have transportation to go to the fire facilities where they used to go and do their immunizations.
Behind each successful vaccination visit is a process of planning and tracking. Through the Micro Coverage Tracking Tool, MCTT, health teams are better able to coordinate enumeration, identify eligible children, track zero-dose and under-immunized children, and support follow-up across communities.
So we plan to use our tool, the MCTT, the Micro Coverage Tracking Tool. We're going to be using that to enumerate households. So we're going down to 10 LGAs to also do a form of enumeration. Now, once we do this, we'll be able to have targeted vaccinations. They will help lead the vaccination teams to enumerated households, and then we'll have targeted vaccination.
If you look at the training we receive, the aim of the project is to improve health of children and ensure that they are thoroughly vaccinated. No missing child in the entire landscape of Adamawa State. Now, the tools that we are trained on today, we discovered that it's going to track a child from building to building, from locality to locality, which is a new innovation in improving the health of our children in Adamawa State.
The MCTT app has helped me a lot to document my data there, the children's date of birth, to track my defaulters and also their next date of visit. Before the STRICAAN project started, we used to find it very hard to reach out to the faraway communities. But since the STRICAAN project started, we have found it easier because there is funds. You support us with funds, so it makes it easier for us to reach out to the faraway communities, and it has also improved our data accuracy and quantity.
Okay, with the coming of the STRICAAN project, it has helped me in building my capacity as an area focal person of the facility. It has helped me in updating my micro plan, an immunization section, and it has helped me in tracking children, missed children that are very far from the facility. It makes the work easier for me.
Reaching every child also requires coordination. Different partners, resources, and interventions must align to avoid duplication, close gaps, and ensure that support reaches the communities where it is most needed. The Partner Resource Mapping Tool, PRMT, supports this process by helping stakeholders understand who is working where, what resources are available, and how partners can better coordinate around immunization priorities.
The PRMT actually help us to know what resources are available, how we are using those resources, and the gaps that we have, and then how we fill up those gaps. So with that, we're able to reach the wider coverage of the state. With that, we're able to plan better, coordinate better. Government budget sometimes cannot cover everything. So if you have partners that have already taken some responsibilities, it makes it easier to allocate the little resources you have to other areas that may need the same services. We have the largest state in the country, with about 25 local governments, with over 4,000 hard-to-reach communities. So when we have these resources that are made known to us, it helps us to actually plan better, and then of course have our children adequately immunized and other primary health care services that we offer.
For the system, this child may represent one data point, but for the mother, this child is everything. Every vaccine received is a layer of protection. Every visit from a health worker is a reminder that her child has not been forgotten.
Yeah, my expectation now is that the immunization coverage will be increased, and also disease surveillance system, particularly the surveillance officers, their capacity will be built. At the end of the day, the health promotion of the people of the state will be increased and maintained.
In these states, the STRICAAN Project is demonstrating how community engagement, frontline health workers, local leadership, and technology can work together to reach children who may otherwise be missed. This is what progress looks like: a child protected, a mother reassured, a vaccinator equipped, a health system strengthened.
Gaskiya yanda na ji alhamdulillah, tunda yanzu ko da wani ciwo zai zo, tunda na riga na yi gane mahimmancin wannan allura, ko da zai zo ban da wani fargaban cewa ciwon nan zai zo ya ji mata, sai dai kuma walwalan da take samu ba irin wanda ba su samu rigakafi ba. Kuma alhamdulillah mun gode ma wannan Sudani da suke zuwa suke taimaka mana.
I would like to thank the Niger State Primary Health Care, the Sudani Group, the supervisor, and the CDC for making healthcare better in Niger State.
So now we want to use the opportunity to appreciate the support of the Sudani for supporting the state by contributing their own quota to the health promotion of the people of Adamawa State. We are ready to cooperate with you so that at the end of the day, the goal of the project will be maintained, will be achieved and maintained even after the project has been wound up.
We just want to use this opportunity to thank the state team for welcoming us well. We met with the executive chairman, we met with the directors, and it's been so good. So we're very sure that this dashboard will be very useful for further implementation and for also scale up to other LGs.
Through STRICAAN, Sudani Group is supporting a stronger and more responsive routine immunization system in Niger and Adamawa states. This documentary is brought to you by Sudani Group in partnership with the United States Centers for Disease Control and Prevention, the Niger State Government, and the Adamawa State Government.